Master the skills of cultural competency to build stronger relationships and navigate any professional or personal environment with confidence and respect. This course provides comprehensive insights into cultural competency, an essential skill for delivering respectful, effective healthcare in diverse populations. Learners will explore culture's influence on communication and health, recognize personal biases, and develop practical strategies for inclusive, empathetic patient and team interactions. Cultural competency is the ability to understand, respect, and effectively interact with people from diverse cultural backgrounds. In healthcare, this skill ensures equitable care, reduces misunderstandings, and improves patient satisfaction and outcomes. This course guides healthcare professionals in developing self-awareness, overcoming cultural barriers, and communicating with sensitivity and respect. Introduction to Cultural Competency in Healthcare. Definition and scope. Cultural competency involves knowledge, attitudes, and skills to provide care respectful of diverse cultural perspectives. Importance. Increasing cultural diversity in populations demands adaptable care to meet varying health beliefs and practices. Outcomes. Culturally competent care leads to improved patient trust, adherence, and health equity. Frameworks and models. Overview of cultural competence models such as Campina-Bocote's model. Awareness, knowledge, skill, encounters, desire. Healthcare implications. Examples of cultural misunderstandings affecting diagnosis, treatment, and patient satisfaction. Understanding culture and its influence on health beliefs and behaviors. Defining culture. Culture encompasses language, religion, customs, values, social norms, and traditions. Health beliefs and practices. How cultural perspectives influence views on illness, pain expression, healing practices, and use of healthcare services. Examples. Some cultures use traditional healers. Others may distrust Western medicine. Communication styles. Direct versus indirect communication. Eye contact norms. Gestures and body language differences. Family and community roles. The influence of family structure and community on health decisions. Case studies. Exploring cultural beliefs impacting care plans. Self-awareness and bias recognition. Implicit and explicit bias. Understanding unconscious attitudes and their influence on healthcare delivery. Reflective practice. Techniques for examining one's own cultural background, assumptions, and prejudices. Impact of bias. How bias can lead to unequal care, miscommunication, and poorer outcomes. Strategies to mitigate bias. Open-mindedness. Cultural humility, recognizing limitations in one's cultural knowledge. Continuous learning and exposure to diverse cultures. Exercises. Self-assessment quizzes and journaling prompts. Communication strategies for cross-cultural effectiveness. Verbal communication. Use of clear, simple language, avoiding jargon. Confirming understanding through teach-back methods. Nonverbal communication. Awareness of cultural differences in gestures, touch, eye contact, and personal space. Active listening. Empathetic listening to patients' stories and concerns. Using open-ended questions. Encouraging dialogue and patient expression. Building trust. Showing respect for cultural values and beliefs. Scenario practice. Role-playing patient-provider interactions. Overcoming cultural barriers and misunderstandings. Language barriers. Working effectively with interpreters and translation services. Avoiding reliance on family members for interpretation to maintain confidentiality. Health literacy. Assessing patient understanding. Using visual aids and culturally relevant materials. Religious and spiritual differences. Respecting dietary restrictions, prayer practices, and end-of-life rituals. Mistrust of healthcare system. Strategies to build rapport with historically marginalized groups. Conflict resolution. Handling cultural misunderstandings sensitively. Ethical considerations in culturally competent care. Respect for autonomy, supporting informed decisions consistent with cultural values. Justice and equity, providing unbiased, fair care regardless of background. Confidentiality, maintaining privacy while respecting cultural communication preferences. Informed consent, ensuring cultural factors are addressed in consent processes. Advocacy, acting as patient advocates for culturally appropriate care. Ethical dilemmas, navigating conflicts between cultural beliefs and medical recommendations. Working with interpreters and multicultural healthcare teams. Role of professional interpreters, ensuring accurate and confidential communication. Best practices, speak directly to the patient, not the interpreter. Use short, clear sentences. Allow time for interpretation. Telehealth and technology, using remote interpreting services effectively. Multicultural teamwork, valuing diverse perspectives in care planning. Addressing team communication challenges, respecting different communication styles within teams. Building an inclusive and respectful healthcare environment. Organizational culture, fostering inclusivity through policies and training. Patient-centered care, tailoring care plans to cultural needs. Cultural celebrations and recognition, respecting and honoring patient traditions. Continuous education, encouraging ongoing cultural competence development. Measuring outcomes, using feedback to improve culturally competent care. Creating safe spaces, ensuring patients feel valued and understood. Conclusion and recap. Cultural competency is vital for equitable, effective healthcare. This course empowers CNAs and healthcare workers to communicate sensitively, recognize and overcome cultural barriers, and provide respectful, patient-centered care in diverse healthcare settings.